So keep it locked in right here on the show. A very interesting topic today. And while we'll be talking to our guests in the studio, Professor Dr. Tan Mo Pin, who is the head of geriatric, the medicine unit from University Malaya Medical Center. And while living with dementia, this is a very important topic, as I said earlier on, and a very interesting one, especially for those of you who probably might know somebody who is having these problems. And while the good professor, our guest in the studio, will be at least explaining to us a little bit more on our topic for today. Now, just to let you know that dementia is or happens to be a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to, get into our lives or interfere in our daily life. Now, Alzheimer's is the most common cause of dementia. So getting into our questions, but just before that, we would like to get to know our guest in the studios, Professor Dr. Tan Mo Pin. And a very good morning to you, Professor. Professor, could you just tell us a little bit more about yourself and, probably a little bit of what you do as a profession?
Yes. Good morning, Gilbert. And thank you very much for having me on the show.
You're welcome.
So geriatric medicine sounds like a mouthful.
Oh, yeah.
And a lot of people don't know what it is, but some people are starting to consider geriatric as a derogatory term.
Okay.
But actually, we are basically looking after older adults. So older, we tend to use an age cutoff,
Okay.
but actually it really depends on biologically how far you have aged.
Okay.
But usually about 60, 65 is what we say you're old. And older people tend to have a tendency to accumulate medical problems,
Okay.
and then they take many medications. And so when they come to hospital, they often have a lot of side effect to their medications, and the presentation tends to be very non-specific. And therefore, the geriatrician has to actually be able to be more of a detective, a diagnostician.
Okay.
And then management can be tricky because they've lost the ability to care for themselves.
Mm-hmm.
So you need to do rehabilitation and also plan their discharge home such that any needs of theirs is properly met, so that they don't suffer any long-term, as little long-term negative effects as possible.
Okay.
It's a very complex subspecialty.
And it's, I should also say that many, as you say, when they age, right?
Yes, yes.
And this is something which is very common.
Yes. that's
So
right.
that's overall on how common it is actually, Professor, dementia.
Dementia.
Yeah.
Yes, so dementia, according to our National Health and Mobility Survey, which was done in 2018, 1 in 12 people over the age of 60 have dementia.
Okay.
And we do know that people with dementia, from the time the disease has occurred, can live for 8 to 10 years. So there are a lot of people with dementia hanging around in the society. And when they have dementia, they're more likely to need care, hospital care, and also care in care homes. So when we talk about hospitals, we've done a survey in the University Malaya Medical Center. 1 in 4 people over the age of 65 who come into hospital actually have memory problems. We call it cognitive issues.
Okay.
And when we look at the over 80s, we're talking about 1 in 2. So more people with who are over 80 who come to hospital have problems with their memory compared to those who haven't.
Okay.
So and when we look at care homes, long-term care, nearly all residents in a long-term care facility in a nursing home will have some degree of memory issues.
Okay. When you're talking about this one here, it's not in our question. I like to get off my sheets sometimes.
So do I.
Doctor, Mom takes this. It's like a vitamin, all right?
Yeah.
To enhance cognitivity,
Yes.
or something like memory, right?
Yes, yes.
Can things like this help, Doctor?
Okay, it really depends. Yeah,
To prevent.
Yes, it really depends. So generally off-the-shelf supplements, we know that really there's very little evidence that they will reduce the risk of dementia.
Okay.
What we really know is the way you live, your lifestyle. And we know from the recent Lancet Commission report that 45% of risk factors for dementia are potentially modifiable. And most of these risk factors occur at midlife, so between the 40 to 60s. So a lot of us who are living out there before the age of 60 actually need to watch what we do. So there's only one risk factor that is still left in the group that says late life risk factor over 60, and that's social isolation. The rest of the risk factors are majority of them are what you do, how you behave in your midlife. So and those involve risk factors such as high blood pressure, diabetes, sedentary lifestyle, smoking. So those are common risk factors that we know also lead to a lot of chronic diseases, and they also lead to an increased risk of dementia. So it's how we behave in midlife. And so all those supplements, whether they do any good or not, I can't say no. But even if they do, it's not going to be it's not going to be the one that really reduces your risks.
Okay, because if as what you mentioned, Professor, this is things that how you live your midlife.
Yes, that's right.
Very important.
Very.
So it's not just taking those supplements to.
Yes. And we say it's a life course approach, isn't it?
Yes.
So if you risk factors such as educational risk factors. So for childhood, you really need to look at education, prevention of head injuries. I think there's been a lot of things in the news about how these American footballers have an increased risk of dementia, chronic traumatic encephalopathy. So what we do see is if someone has a motor vehicle accident in early life, that will really increase the risk of developing dementia in late life.
Wow. Okay, that's surprising. It's not just something that we pick up just because we're getting old or we're aging, but it's also, as what you said, lifestyle and also damages that has happened in the earlier stages.
Yes.
All right. How does actually dementia happen, Professor?
Okay, so the dementia is actually a problem with the brain. And so when we actually dissect the brain of someone who has died of dementia, we will find that there are these plaques called amyloid plaques.
Okay.
And in the microscope, you also see neurofibrillary tangles. So those are the pathological issues that happens.
Okay.
But we won't be able to know until we actually dissect that brain after the patient have died. So what we do know when we notice from day-to-day life is that we do know now that even because we know that dementia, you can only diagnose it when they've lost the ability to look after themselves on a day-to-day basis.
Okay.
But even years before this happens, so we might notice some behavioral issues. The person might start becoming more impulsive, more exaggeration of their idiosyncratic behavior. So previously, maybe they were already an anxious person, but they are much more anxious nowadays. If previously they were a bit of an angry person, now they can't control their temper. The lid has seemed to have been lifted off. And then over time, they start becoming forgetful. So putting car keys somewhere and then not being able to find them, the famous one is you park your car somewhere and then cannot find it in the car park.
Okay.
Yeah, while this happens to all of us at times,
Yeah.
the person who actually is starting to develop dementia, we call it pre-dementia, will actually experience this regularly. Yeah,
Okay.
and then when dementia occurs, usually the initial presentation is the memory issues. So they stop being able to remember things. So they're managing finances is a problem, and kind of more high level activities of daily living are lost. So finances, going shopping, doing the housework, doing the laundry, so those are what we call instrumental activities of daily living.
Professor, but sorry to interrupt. There are some people who probably might just get this mistaken, being absent-minded, being forgetful,
Yes.
and having Alzheimer's or dementia. So it's way off two different things, right?
Yeah, I mean, we have a lot of fun when we talk about these things. It's like, oh no, I keep forgetting.
Yeah.
Have I got dementia? We do know that there are a lot of conditions that will actually mimic dementia. So we call it pseudo-dementia. And this happens when, let's say, you're very unwell. And you can have what we call a delirium. Okay. So that will seems like it's dementia, but when you recover from your illness, your memory comes back. Okay. So then it's not dementia. And then there is also like depression. So you're feeling very depressed, and your mentation is very slow. Then it would appear like you have dementia, but if we are able to treat the depression, then the memory comes back. So those are, we call pseudo dementia. But there's also the absent-minded fellas. Yeah, so there are people who have been absent-minded all their lives. You cannot blame dementia.
Yes.
Yes.
So that's the one I've always wanted to know. Don't get it complicated.